The next is Government of India in 1999, they had NPOP, National Policy on Older Persons. And this NPOP, National Policy on Older Persons, were talking on financial security, old age, you need money for your health and other day-to-day activities, you need good nutrition and health care, you need shelter, welfare, education, protection of life and prosperity. So NPOP, you can see National Policy on Older Persons, were working on the principle of financial security, nutrition, healthcare, shelter, welfare, education, and protection of life and prosperity. In 1919, to execute this policy, we had NCOP, National Council of Older Person, and it was further renamed as NCSRC. What is National Council of Senior Citizens? It was National Council of Older Person, doesn't look good. So National Council of Senior Citizens. And this was working on how self-help group is formed, how there is an association of older persons so that their rights and utilization of services is done and their experience is utilized. So what did they do? They established old age homes, they had mobile medical units which was working for old age. We have also social assistance program, old age pension, and somewhere in Assam they used to give 75 rupees per month. In West Bengal and Rajasthan, 300 rupees per month. It may increase. We have also Oasis project, which is old age, social and income security. Try to remember Oasis, old age, social and income security. For example, the railways, airlines, state transport all gives discount to senior citizens. In railways, you have a senior citizen discount. Nowadays, it is not there. Probably it is very less. The lower berths are reserved for senior citizens. So those sort of social security and income security comes under Oasis project. There are different insurance schemes for there is a Bhavishya Arogya Mediclaim, income tax concession also they get life insurance schemes are there. Ayushman Bharat nowadays is taking care of that. In 2007, what did they do? They also came up with Indira Gandhi old age pension scheme, where 65 plus people were getting 200 rupees by the central government and equal amount of money by the state government also. So this pension scheme was launched so that people who are in below poverty line and 65 plus, they may get certain amount of money so that he or she can take care of herself or himself. There is a voluntary organization, HelpAge India, which works on older people, and it is involved in cataract operation. They have mobile medical units. They also ensure income generation and microcredits. They daycare centers and old age homes are there. They also follow a principle of can we adopt grandparents. They are also on disaster mitigation, right? So the HelpAge India works on old age or geriatric population. What are the levels of preventions as far as gerontology or geriatrics is concerned? So areas potentially amenable to preventive healthcare in elderly. What are the areas? So let's talk about primary prevention, action taken prior to onset of disease. So healthy habits, leave smoking, alcohol, obesity, nutrition, physical activity, sleep. Coronary heart disease risk factors, try to prevent that. Immunization, please immunize old age people with tetanus, influenza, pneumovax as and when required. And also injury prevention, osteoporosis prevention, iatrogenic preventions. All this can be done as primary prevention. In secondary, keep on screening for hypertension, diabetes, dental problems, sensory impairment, the cancers, the anemias, depressions, urinary incontinence, fall risk, TB, syphilis, MI, all this screening should be done. Tertiary, now the disease has already taken place. This was to early diagnose the disease. This was for early diagnosis and treatment. This was prevention prior to the onset of disease. And this now the disease has progressed. You can only rehabilitate. Please ensure physical deficit, cognitive deficit, functional deficit is taken care of, and support necessary to prevent loss of autonomy. Please ensure that the loss of autonomy is less. We need to prevent loss of autonomy. because that independent living habit suddenly becomes dependent. No, it's not easy to recuperate. Okay, so these are areas where we can work in elderly: primary, secondary, and tertiary. Think from the level of prevention point of view. Primary, what you can do, all the nutritional problem, immunization, injury prevention. Secondary, screen for diseases, diabetes, hypertension, dental problem, hearing problems, nutritional problems, now urinary incontinence, syphilis, TB. Tertiary, you have to support, rehabilitate, right? Support to prevent the loss of autonomy. The Government of India is also running a program, National Program for Healthcare of Elderly, which is NPHCE, National Program for Healthcare Elderly, right? What is the vision of NPHC? Vision is accessible universally. You remember just now we talked affordable economically, high quality, long term, comprehensive and dedicated care services to an aging population. You need to provide accessible, affordable, high quality, comprehensive and dedicated healthcare services to the aging population. Can we create a new architect for aging? Can we make a framework to create an environment which is enabling society for all ages? Now, very famous, very good line. Society for all ages. It should not be young people should only get the benefits or should be only leading from front. It should be for all ages. And can we promote the concept of active and healthy living? You need to be active. You see your grandparents, are they going outside or not on daily basis? They should go outside, they should mingle with the people, they should discuss, they should come and say what has happened. They have to feel that they belong to the society. So this is the vision of National Program of Healthcare for Elderly, for accessible, affordable, quality services to an aging population. You need to have a new architecture of aging. We'll talk about enabling environment society. It is society for all ages, and you promote the concept of active and healthy aging. Core strategy. Now, how will you do all this? Big words. Can we ensure primary healthcare approach, which is the basic thing, where home visits are done by trained healthcare workers? So there are people, old age people. So suppose a healthcare worker walks inside the house and say that I have come to do a periodic checkup for this old person, geriatric population. Good strategy can be done, effective. At the PHC and CHC, can we include provision of equipments, machines, now human resource IEC, so that they can take care of geriatric population? At the district hospital, can we have 10 bedded wards focused for geriatrics? Can we have additional human resource? Can we have all the logistics? Good. So this is the old age architecture which we were talking about. Architecture for new aging. Can we have medical institute? There are 8 regional medical institute who can provide dedicated tertiary level medical facilities for all elderly. It should have PG courses in geriatric medicine, in serving training for all human resources. Can we use IEC, through mass media, folk media and other communication channel to reach out to the target community? Let's focus. We have old people. Let's do mass media. Can we use the posters and banners, folk media, to generate awareness about geriatric, how levels of prevention can be achieved in geriatrics? And the last one, which is always there in any program, monitoring, evaluation and research, right? So these are core strategy. Now let's say the facility and what services can be given. So at the sub center, if you see, what can you do? Health education. You can now make aware older people what they can do to have good health. Home visits can be done by our health workers. No, arrange for suitable calipers and supportive device if it is required from PHC. They can, if somebody requires, they can coordinate with the PHC and get it done. They can also link the old age with support groups and daycare centers. This type of activity is expected at sub centers. At PHC, what you can have? Can we run a weekly geriatric clinic? Can we maintain records of the elderly people using a format? Can we do routine health assessment? Right? Can we provide medicine and proper advice? Can we generate awareness of preventive, promotive and rehabilitative aspect? Can we refer the person, if required, to the higher center? So this can be done at the PHC. At the CHC, which act as a FRU, So FRU for PHCs and below, for elderly, not for mother and child. Geriatric clinic twice a week, at PHC once a week and CHC twice a week. Rehabilitation unit for physiotherapy and counseling. Home visits by the rehabilitation worker. Health promotions and prevention. Referral of difficult cases to district. At the district hospital, can we have 8 bedded specially, not 8 bedded, sorry, 10 bedded ward for geriatric population, inpatient care, 10 bedded, right? Regular OPD services should be done. We should have a speciality like medicine, orthopedics, ophthalmology taking care of this, right? They can take care of patients referred by PHC, CHCA and below. Need to conduct camps, referral service to tertiary care if they are not able to handle it. And last is regional geriatric center. They are saying it should be 30-bedded geriatric ward, and you can give all the tertiary care services here, and they can take care of all the specialist, means all the specialized healthcare services which is required for geriatric population. The testing can be done. Tertiary healthcare to the cases referred from medical college, district hospital and below. They can, so specialist services can be provided at the regional geriatric center. So you can see this is the architecture which I was talking about. I'll go back. Architecture for aging. So as far as health services, at the sub center also we are taking care of geriatric population. At PHC we are taking care of geriatric population. At CHC, district hospitals, and finally the specialized centers, tertiary care centers, the medical colleges, which we have regional geriatric center, right? So this was all about geriatrics or gerontology, whatever you say.